Are these the worst HTMA test results ever? In this video, I review the test results from a 30-year-old woman with serious health problems. And I gotta say, this is probably the worst test results that I've ever seen. So let's take a look. First, I just want to point out that it's very difficult to determine just how bad a hair analysis is compared to someone else. For example, I always have clients asking me, how bad is it? And have you seen worse? Well, the nature of hair analysis, the nature of screening tests are that it's very difficult to give you a straightforward answer. So I always give a nuanced answer because there's a lot of factors involved, including a person's age and just the differences between the patterns and the different imbalances found on the test. So it's hard to say just how bad a hair analysis is, but the hair analysis I have before me, I can confidently say that this is not a good situation. And if you look at the person's symptoms, which we have listed on the right side here, it's obvious that this person is not in good condition. And I spoke with this person, and I can add some context to the situation and tell you just how bad her health is. For example, this person has something called Behcet's disease, which is a inflammation of blood vessels throughout the body. She has epilepsy, which means seizures. She has another condition that I cannot pronounce the name, which involves inflammation of the joints in the spine. In addition, she also had a colectomy, which means she had her colon removed, which means that she now has an iliostomy, which is a bag that helps remove her waste. So she has very significant health issues, and I didn't need to tell her that based on her test results for her to understand that. So this person is not in good condition, and let's take a look to see how that translates to her hair analysis. So here's the hair analysis, and if you're not familiar with hair analysis, I just want to point out that these black dashes across the middle, that's the ideal level for most of the minerals. It's not exactly accurate for some minerals like iron, copper, maybe even manganese, but when we look at the first four minerals, the major electrolytes in the body, or at least a few of the major electrolytes in the body, all of those are below the ideal value, and we call that a four lows pattern. That is considered one of the most important patterns and the most serious patterns that we can find on the hair test. Normally, when the sodium and potassium levels get low, that has to do with lower adrenal hormones. But normally when that happens, the calcium and magnesium levels will rise in response to that. In a four lows pattern, that doesn't occur. So it tells us that something is really wrong with the person's metabolism and glandular system in particular. And it normally has to do with a person being very depleted nutritionally with a lot of toxicity on top of that. So this is an important pattern, and right off the bat, we know that this person is not in good condition. Now, to the right of the chart, you can see that most of these trace minerals are below the ideal value as well. And that's not too uncommon, but the two that I want to point out is the very low level of zinc, which is a very significant imbalance that has to do with protein synthesis. Zinc is involved in the synthesis of all proteins in the body. It's involved in the immune response and hundreds of other functions, really. So a zinc deficiency is an important finding that we can find on a hair analysis. Phosphorus is actually not a trace mineral, but a macro mineral, and a low level of phosphorus has to do with impaired digestion, usually in some way, and we know from talking with this person that they've had their colon removed, so there's going to be some problems with digestion and malabsorption. When we go down to the toxic metal section over here, the aluminum level is extremely elevated. And a high aluminum level is not uncommon today, but her level is about 10 times what it should be. And It may have to do with some of the medications that she's taking. She's taking half a dozen or more medications, and a lot of them, or some medications, can contain aluminum. The other toxic metals on this test are low, but she likely has most, if not all, of these toxic metals in other areas of her body. Another major imbalance on her test involves the balance between sodium and potassium, which is very critical for health. Her sodium to potassium ratio is 1.0, which is extremely low. It should be about 2.5 to 1, and anytime it gets below about 2 to 1, usually there's health issues involved. And when it's as low as 1 or below 1, it involves adrenal exhaustion, pretty severe adrenal exhaustion, impaired immune response. It has to do with blood sugar issues. It has to do with heart issues. It has to do with excessive protein breakdown and possibly more serious health problems. The low sodium to potassium ratio on her test is combined with a low calcium to magnesium ratio. And when both of those ratios are low, we call that a double low ratio pattern. And Dr. Larry Wilson calls it a double give up pattern, meaning that the person often feels like giving up and moving on, so to speak. And this makes sense for this person because she has some very significant health issues and her quality of life is probably very low. So this should give you some perspective about what we can find on a hair analysis. And if you have a hair analysis done with me, you don't want it to look like this.